Call Dr. Bruce Hopper. Hello? Oh, that aggravates me. Give me that phone. Call Dr. Bruce Hopper. Call Dr. Bruce Hopper. Hello? Hello?
Calling Bruce Hopper, doctor. Work.
See? What is wrong with you? Now you know I get aggravated.
I know. I'm Bruce Hopper, Jr., MD. My medical practice is called On Call Health, right here in Philadelphia. I founded it about 2 years ago. I landed a fantastic job right out of my fellowship. I was lucky enough to be one of the physicians for the Philadelphia Phillies. Soon after that, I started getting really tired of just the reality that I had to see so many patients every day. I was trapped on a hamster wheel. I'd see about 40 to 50 patients per day. I remember one time a patient I bumped into on the street soon after work one day that I had seen about 2 hours before, and they came up and said hello and wanted to ask me a question, and I had absolutely no recollection of who that person was. And so right then and there was a signal that this is not what I wanted to do professionally, and I began looking at other models of care. Finally, started one-man solo general medical practice. I consider myself the doctor for the working class because I think if you take away insurance companies, you can create a higher quality, lower cost service. Starting your own practice as a solo general practitioner is extremely challenging. I guess the biggest challenge is that my competition is a $3 trillion insurance industry. That's quite powerful. I'm functioning now as a, I guess, disruptive innovator. And I really love the idea of building a new system from the grassroots, from the bottom up. So the other rewarding part is really being able to spend time with my patients. I can also incorporate house calls into my practice where you can really learn so much from that experience of venturing into someone's home. It's really reinventing that whole patient-doctor relationship.
I remember being little, the doctor would actually come to your home. You know, he was part of the family, and you were a person. His way of thinking, it reminded me of my doctor when I was younger. And that's the kind of doctor that I like, a doctor who cares, who returns your calls 1, 2, 3, no matter what. You have a right. You're paying a doctor for a service, and I think you should be able to ask them any questions you can. And if they don't want to answer you, it's their prerogative, you know, to say, well, I don't want to be your doctor.
What if I were the best physician in the world? I just had the best outcomes. My patients were the healthiest. I kept them out of the hospital. I kept them healthy. How would I be viewed by the medical administrator of the hospital? Like, what if I set up my practice across the street from the hospital and I just performed this uber high quality care and my patient panel was just incredibly healthy and never really needed to use the hospital? I said, what if that were reality? What would happen?